what happened with COVID actually, and I would talk a little bit about what happened with us and what happened in healthcare. Of course, uh, first quarter in this year, of course, everybody looked at saying that this is a crisis which was happening somewhere else, it was in China and some other countries, and we had various theories about India being impacted by it significantly or not. But of course, as this crisis set its foot in India, the crisis started becoming bigger and bigger. And you realize by April time frame that the way healthcare was consumed before that, people were wary of going to the hospitals, people are wary of having anybody else come to their homes, and in general, the mobility factor of the patients or even healthy people got totally curtailed in this. I think there's one big change which happened. A lot of people started working from home in April timeframe, and of course, India started seeing the surge of COVID positive patients starting from April. And this basically created, or this pushed us and of course the whole healthcare system ecosystem in the country to look for innovative solutions so that you can support patient in the completely new dynamics, in the new environment which got created, and it has been quite rapid. So the way the whole thing has unfolded, the timing has been very short. I mean, what you would have done probably in starting a new company or starting a product, maybe in 3 months, 6 months, you had 2 or 3 weeks or 4 weeks to think through that and start actually. So what we looked at as one of the innovative solutions, and also how to support the country and the patients in this crisis, we looked at how we could manage and support COVID positive patients at home as much as possible. But that has been our skill, and that's something which we started working on the model. We have done infection management before that at large scale for many of the patients, and then we looked at how we could morph that product into creating something where we could go and support patients at home. So of course, initial stages in April timeframe, first government was saying that all the COVID positive patients were to take into a facility, and then of course sometime late April it got decided at a regulatory level that COVID positive patients who are asymptomatic or mild symptoms can be managed at home, and that's how this whole idea came into play. So we started working with a couple of governments in May timeframe and said, can we work together and manage COVID positive patients at home? So of course, the first program which went live was with the Delhi government. I'll give you a brief of how the whole process worked. So this became a perfect combined efforts between us and the government, because with all the lockdowns and everything, the mobility on the ground was very difficult. So the way we created the program, that we, given our medical expertise, given our teleconsultation expertise, given our patient management expertise, will pull the whole program together. So the way it works is that everybody who tests positive, government will get the list of those patients and look at who are those out of those patients who can be home isolated. Of course, with that list will get shared with us, and the complete medical SOPs and everything around that got created along with the government. Very fairly detailed SOPs got created which were all basically loaded into our patient management system, and that the list comes to us, and we have a pool of healthcare workers who are well trained on managing this COVID positive patients. So every patient who's supposed to be home isolated gets onboarded by a healthcare worker with a detailed onboarding call, and then of course gets followed up through the isolation period of whether it was started as 17 days, then of course became 14. Nowadays the government regulation is around 10 days. So during that period, how do you manage that patient completely? You talk to them every day with a healthcare worker. You do doctor teleconsultation for them wherever needed. Roughly 10 to 12% of the patients every day require a doctor consult. And then you also manage any of the emergencies which they have, where you can take the patient to the hospital where they have moved to the hospital. In our experience in working in various governments, 10 to 12% patients needed doctor teleconsult every day. Roughly 3% patients needed to be moved to the hospital, and less than 0.1% mortality rate out of this whole process. And of course, the pieces which we did totally, we pulled the whole thing together. Doctors used our system. They used an Android app basically to call to the patient and maintain all their records. They had access to all the central records in one place. And some places government provided a doctor, otherwise we use our own doctors. Government provided all the on-ground support in terms of patient visiting visiting patient homes to check whether they are fit for home isolation or not. Any of the escalation management, any of the emergency management was done by the government. And as a combined effort, this program got launched. We launched it for Delhi, and of course, numbers started growing rapidly. And in last 3 months, this first program went live in May first week. Now you're in August first week. In last 3 months, we have worked with various governments, managing this process for them, and have managed over 50,000 patients successfully in home isolation. So that's something. If you look at total patients who have basically recovered from COVID in India so far, will be close to 12 lakh or so. So roughly 4 to 5% of those patients have been managed by us in home isolation along with governments in a combined effort. And this has basically helped governments a lot to reduce the load on the hospital ecosystem. So earlier model, all these patients would have landed up in the hospital. So saying these patients, of course, don't go to the hospital. It's also a big relief for the patients because they know they can recover at home. And Delhi program was quite successful. Then, of course, other states launched it. And I'll give you a quick summary of what all we have been able to do so far with this particular program. So far we have done this program management for various states, that is Delhi, Chennai City, Bangalore we are doing, Mumbai, Punjab, Gurgaon and Faridabad. Of course, in discussion in many other state governments as well, where this program has been successful and how we can make it more and more robust. Where we can use more technology to make it more scalable and useful for the patients. Done 50,000 plus patients, managing close to 2,000 patients a day on this right now. So the other highlights I talked about, but I think the big positive out of it has been that the relief on the healthcare ecosystem has been fairly high. I mean, if you look at the other developed countries with Italy and Spain and US and other countries also had tremendous load on their hospital ecosystem. India, we have been able to support governments in our own small ways to reduce the load on the healthcare ecosystem. Of course, we did a lot of other programs as well. We ran mobile clinics in Bangalore. Bangalore gave their BMTC buses, and of course, we partnered with a couple of other players and ran mobile clinics where these buses will go to various societies and people could come and show their symptoms and get consultation with a doctor and any blood test if they wanted to do that. Of course, ran a chat bot for one of the governments, Goa government, in the initial days to give all the COVID-related information when it was really early stage. So some of the other initiatives also which we have launched, which has been able to support the government and the country in managing this whole crisis. So I just wanted to give this as an example and say any of these situation, and that's where the healthcare market in India is going. And I thought we'll talk a little bit about where the next set of opportunities and challenges are coming and how the healthcare ecosystem will change. And this one example where we could make the best use of what is possible with our expertise, what is possible with other support system like a government, hospitals, the labs, and everybody putting together to create a solution which is need of the hour, which helps large number of patients, and which has really served the country in this hour of crisis. Here's some of the patient testimonials. I just give a quick one case where a pregnant woman, she was COVID positive. We are managing her at home. And of course, she had to go to labor. And we coordinated with the government in the night to take her to the hospital and make sure and she had a successful delivery also. And there are many examples like that. I just want to give one to give the extent of support which was possible to give to the patients with this combined solution between driven by Portea and of course worked along with the government. Then as we start working on this, we also realized there are other areas, and as the COVID scare became bigger and bigger, and India is getting enough number of cases, given that we are a large country and a lot more testing is happening, we also looked at how we can go to newer areas like communities. So we realized that communities now are looking at, if you get a COVID positive patient, whether they get treated at home or they get treated within their community, within their clubhouse, can you provide oxygen therapy for them? Can you provide whole of nursing support for them? Can you also look at giving people protection programs, which they know that, okay, even if they are not positive, what they need to do to make sure they're protected from COVID? So there's another recent program which we have launched where we are working with a lot of communities across the country and providing them multiple solutions, including doctor teleconsultation, testing on site, the remote monitoring, 24/7 helpline. If somebody, all of us have multiple questions, and if something happens, what will I do? Whom do I call? How do I manage emergency? Can we create a center within the community? We have created centers within the community in Bangalore, for example, where the local authorities have allowed this to happen. So this is another solution which we believe is the need of the hour and will sustain. So the way a lot of corporates, if some of you are aware, will have medical rooms. We believe that going forward, even communities will start having medical centers and medical rooms. And that's something which is started providing around a month and a half back. Again, has been able to support people at large to manage COVID positive patients, as well as manage healthy people also. Their well-being also is being managed at home for them and within the community. So this basically provides the overall sense of well-being. And of course, psychologically, it's a lot more positive for people to be treated at home or within their community. So these are solutions which we have recently launched and are seeing good traction on that. Again, part of what is possible to do in innovation, something in healthcare is something which we have been able to build.